Hi everyone, my name's Allison Didier and this is my audience. 194,377. This is the number of babies born to teen moms above the age 15, according to the CDC in 2017. Each one of these moms was faced with an array of different emotions and decisions that no one should have to make alone, let alone a teenage girl, which is why I believe it should be required for a minor to get parental consent before having an abortion procedure. I think that a decision like this would help a teen think more thoroughly through their decision and the effects that it has, as well as give them that extra push that they need to talk to their parents and hopefully receive some support. So over the years, I've done extensive research on this topic, and as a woman, I feel that I understand some of the emotions that might happen when making a decision like this. And then, not only that, but this is a hot button issue in our culture. As you know, we just had the recent election and many controversial things were discussed. And then not only that, but here in California, we rank the 6th highest number of abortion procedures in the United States. And then also, in California, there are currently no requirements for a minor to get any parental consent before having an abortion. So, as we dive into it, I thought that it would be important to discuss some of the different methods used for abortions. But before we do that, I wanted to give a bit of a disclaimer, because I know with an issue like this, it can be pretty sensitive and controversial, and I wanted to make sure that you know that I'm aware of the different issues surrounding this topic, and I wanted to give you a bit of a heads up before we talk about some of these procedures. So, with that being said, the most common method used is called vacuum aspiration, and according to healthline.com, vacuum aspiration is done during the first trimester, which is 12 weeks, or up until the early second trimester, up to 16 weeks. And so this procedure is done in a clinic, and a doctor or nurse will dilate the cervix and then use a suction tool to remove the contents of the uterus, which includes the pregnancy tissue and the fetus, therefore terminating the pregnancy. So some of the expected symptoms that someone will experience are bleeding, cramps, nausea, and sweating. And then, according to Healthline, they recommend for the patient to take at least like a day or two off of work or school because of the discomfort that they'll be experiencing. So now that we've discussed vacuum aspiration, I thought that we should get into the second most commonly used method, which is called medical abortion. So in medical abortion, there are 2 different medications used. The first one's called mifepristone and misoprostol, and these need to be given in a doctor's office or clinic, and the first one is given by the doctor, and the second one is given to the patient to take home and take a couple hours later. And then soon the patient should expect to experience heavy cramping and bleeding. And then following this, some of the symptoms will include blood clots, heavy bleeding, cramping, vomiting, dizziness, diarrhea, fatigue, sweating, and headache. So it's also recommended that they take off this amount of time, or 4 to 5 days, as this amount of time is what's required for the pregnancy to pass. And so after that, I thought that it would be important to show a picture of what a baby actually looks like at 16 weeks during the second trimester. And now I thought this was important to include because often when we hear things like first and second trimester, we don't really take into consideration what's happening. So as we've seen, there are a lot of physical effects that an abortion can have, but one can also assume there must be some mental and psychological effects as well. Well, according to the Pregnancy Resource Center of Oregon, 90% of women suffer emotional effects after having an abortion procedure. Some of the symptoms that they can experience are bouts of crying, depression, regret, guilt, anger, sleep disturbances, panic attacks, anxiety, and it can even lead to substance abuse. Now, I know that's not the case with all women, but it is statistically common enough that most abortion clinics will also provide counseling services because of these issues. So, as we can see, an abortion is a pretty serious decision, and not only does it affect the mother, but it also affects the father, the child in the womb, and even the grandparents. So it's not something that we should take lightly. And then I wanted to give you a scenario to think about. Think about this. A 14-year-old girl can't even go on a class field trip without parental consent. So she should not be able to bear the weight and responsibility of making a life-altering decision without the input of an adult. So now that we've discussed that, I wanted to answer or provide some insight on some different counter arguments to this topic. So one common counter argument to this topic is the idea of women who are going to get an abortion because of rape or incest. And I know this is a serious topic, so I don't want to disregard it. But if we look at this statistically, it's not very common in the United States, and it actually makes up for less than 1% of all abortion procedures. But like I said, I don't want to disregard this or brush it aside, so I wanted to help provide a solution for those in this situation. According to Planned Parenthood, in 37 states here, they do require parental consent before having an abortion. And so this can be excused by a judge, though, in these states. And I think that that can help provide a solution to these situations of rape or incest where they can have the parental consent excused by a judge, depending on their situation. So while we're on the topic of counter-arguments, I also wanted to help provide some resources for women who may not have that parental support or are financially struggling. So a good resource for this is the Pregnancy Resource Center. So this is a wonderful organization that provides free services to expecting mothers, and they provide services such as emotional counseling, medical exams, ultrasounds, tutoring, and just a safe community, which is so important in a situation like this. So as we sum things up, we've learned that abortions are a serious thing and they shouldn't be taken lightly, and they affect more than just the mother, which is why it should be required for the minor to have parental consent. And then as we conclude, there are many young girls out there who are facing decisions like this alone because they're afraid of talking to their parents or they're not aware of the resources available to them. So let's be advocates for these girls and help them make decisions not based off of fear, but to thoroughly think things through by talking to an adult. Thank you for listening.